Thank you, Matt. Lung cancer is the world's most common cancer, with over 1.8 million new cases diagnosed annually, and lung biopsy is the definitive method of lung cancer diagnosis. Unfortunately, 1 in 3 patients undergoing a lung biopsy procedure suffer from a collapsed lung, also known as a pneumothorax. This occurs when the biopsy needle punctures the lung and air escapes into the chest cavity. This causes the patient significant pain, distress, and breathing difficulties. A pneumothorax converts a regular and routine outpatient procedure into one requiring hospitalization for invasive treatment at an average cost of $11,000 per patient. Until now, there's been no effective method of preventing this common, costly, and dangerous complication. There are over 1.1 million lung biopsy procedures conducted globally per annum. This market is rapidly increasing due to the rising incidence of lung cancer and the adoption of lung cancer screening programs in many countries. On average, 33% of patients suffer from a pneumothorax. 11% of all patients require hospitalization and invasive treatment for treatment of this preventable complication. Selio will prevent over 121,000 extra hospital admissions and will lead to over $1.3 billion of healthcare savings per annum. With an average selling price of $500 per unit, this represents a very attractive global market for Selio in excess of $550 million. Due to this high complication rate, there have been many previous attempts to solve this problem. All have focused on plugging the hole in the lung after the biopsy procedure. We have been researching this complication now for over 2 years and have discovered why this is. To use an old Irish phrase, they're attempting to shut the door after the horse is bolted. Selio adopts a revolutionary approach by actually preventing the pneumothorax happening before the biopsy even takes place. Selio is a single-use, smart device proven to temporarily seal the needle access route into the lung. The biopsy is then conducted through this Selio airtight seal, preventing any air leak from the lung either during or after the procedure. This enables the patient to safely return home on the same day of the biopsy procedure without the risk of a pneumothorax and the need for a costly hospital admission. Selio is a simple, effective, and patent-protected technology. We know it is effective because it has been rigorously tested ex vivo in our lab and in 12 subsequent in vivo preclinical tests with very positive results. We have visited the leading lung cancer centres across the EU and the United States and have conducted over 100 interviews with experts who carry out this procedure. They have all confirmed that pneumothorax is a significant problem and that a solution will be of real benefit to patients and clinicians alike. There are existing US reimbursement codes for this procedure, and the device will follow a very quick regulatory process and route to market. Selio benefits from a passionate and experienced founding team backed by world-class advisors. Paul Gilson is one of Ireland's leading medical device entrepreneurs. Dr. Paris Dalal, consultant radiologist in the Harefield Hospital in London, leads our clinical advisory team and is a renowned UK expert in this area. We are now raising $1.5 million seed funding to optimise this technology and bring it to first-in-man within 12 months. With your support, Selio will revolutionise the lung biopsy market. It will enable many more patients to receive a definitive lung cancer diagnosis in an easy, risk-free manner. It will prevent considerable patient morbidity, and it will save unnecessary hospital and costly hospital admissions. I wish to thank Enterprise Ireland for all their support to date, and I will welcome any questions afterwards and look forward to meeting you. Thank you very much.